Imagine an organ that filters 50 gallons of your blood every day, silently working 24/7 to keep your body clean, balanced, and functioning. That organ is your kidney. Now, consider this chilling reality. In the United States alone, over 37 million adults are estimated to have chronic kidney disease, CKD, but a staggering 90% of those with early kidney damage are completely unaware of their condition. This means millions of people are walking around with a ticking clock, mistaking critical warnings for simple signs of aging, stress, or a lack of sleep. Kidney failure is often called the silent killer because symptoms rarely become obvious until the disease has progressed to an advanced, irreversible stage. By the time severe pain or major complications occur, the damage may be too profound to fix without dialysis or a transplant. This comprehensive guide is designed to break that silence. We will delve deep into the science behind the 13 early warning signals your body desperately sends when your kidneys are in distress. These are the subtle, seemingly minor issues you might be brushing off daily, but which hold the key to early detection, the single most important factor in slowing down or even halting the progression of kidney disease. If you recognize any of these persistent signs, consider it an urgent call to action. Section 1. The kidneys, your body's master regulators. To truly understand the symptoms of kidney failure, we must first appreciate the vital and complex roles these two bean-shaped organs play. They are far more than just filters. They are the master regulators of your entire physiological system. Key functions of healthy kidneys. Waste filtration. The primary role the kidneys filter toxins, drugs, and waste products, like urea and creatinine, from your blood, converting them into urine. When kidneys fail, these toxins accumulate, leading to a condition called uremia, which causes system-wide poisoning. Fluid balance. They ensure the right amount of water is retained or excreted, preventing dehydration or dangerous fluid overload, edema. Electrolyte balance. They meticulously balance critical minerals like sodium, potassium, calcium, and phosphorus. A disruption in these electrolytes can lead to serious heart and bone issues. Blood pressure regulation. Kidneys produce the enzyme renin, which is central to the renin-angiotensin-aldosterone system, RAS, a powerful hormonal pathway that controls blood vessel constriction and, thus, blood pressure. Red blood cell production. They produce the hormone erythropoietin, EPO, which signals the bone marrow to create red blood cells. Bone health. They convert vitamin D into its active form, calcitriol, which is necessary for absorbing calcium from the gut. When kidney function drops below 15%, end-stage renal disease, or ESRD, the failure of these 6 functions generates the cascade of severe symptoms discussed here. The symptoms of early kidney damage are insidious, often mimicking minor ailments. Pay close attention to these 13 warnings. 1. Persistent fatigue and weakness. The symptom: you feel constantly drained, even after a full night's sleep. Everyday activities, walking upstairs, carrying groceries, or focusing at work, feel overwhelming and require disproportionate effort. This is far beyond normal tiredness. It is a profound, debilitating exhaustion. The underlying mechanism: anemia. This is one of the most common and earliest signs, driven by 2 factors. EPO deficiency. As kidney tissue is damaged, the production of erythropoietin, the hormone necessary for red blood cell creation, falls drastically. Low red blood cell counts lead to anemia, a condition affecting up to 60% of people with chronic kidney disease. Anemia means less oxygen is delivered to your muscles and brain, causing severe fatigue. Toxic buildup. The accumulation of uremic toxins further suppresses energy levels and contributes to a persistent state of malaise and weakness. 2. Swelling in the feet and ankles, edema. The symptom: your shoes suddenly feel too tight by the end of the day, your socks leave deep, lasting indentations, and the puffiness doesn't resolve overnight. This swelling is usually persistent and progressive. The underlying mechanism: fluid and sodium retention. Healthy kidneys remove excess fluid and sodium. Failing kidneys lose this ability, leading to salt and water retention in the body's tissues. Because of gravity, this fluid tends to pool in the lowest extremities first, the feet, ankles, and lower legs. This condition is known as pitting edema, where pressing on the swollen area leaves a temporary pit. As kidney failure advances, the swelling can progress upward to the hands and abdomen. 3. Changes in urination. The liquid report card. Your urine provides vital clues about your kidneys' filtering efficiency. Any persistent change should be investigated immediately. Foamy or bubbly urine. Proteinuria. If your urine is consistently foamy or bubbly, similar to an egg white being beaten, it could indicate proteinuria, excess protein, usually albumin, in the urine. Healthy kidneys retain important proteins. When the kidney filters, glomeruli, are damaged, they start leaking protein into the urine. This is often one of the very first measurable signs of kidney damage. Increased night urination. Nocturia. Waking up multiple times, more than 1 to 2 times, during the night to urinate suggests your kidneys are losing their ability to concentrate urine properly. Research shows this can be an early indicator that the filtering units are failing, requiring the kidneys to excrete more diluted urine throughout the 24-hour cycle. Blood in urine. Hematuria. Urine that appears dark, reddish, or pink-tinged is a red flag for hematuria, blood in the urine. While this can be caused by infections or stones, it can also signify severe damage to the kidney filters. 4. Shortness of breath. The symptom: you find yourself gasping for air after simple exertion, like climbing a familiar flight of stairs or even just walking across a room. This is often misdiagnosed as asthma or a heart problem. The underlying mechanism: dual cause. Pulmonary edema, fluid overload. When the kidneys cannot remove excess fluid, the fluid backs up and accumulates in the lungs, pulmonary edema. This accumulation physically makes it harder for oxygen to cross into the bloodstream, leading to breathlessness. Anemia, oxygen deprivation. As discussed, kidney failure causes anemia, reducing the oxygen-carrying capacity of the blood. Your body tries to compensate by breathing faster, resulting in shortness of breath. 5. Persistent nausea, vomiting, and appetite loss. The symptom: unexplained, persistent nausea that comes and goes, often worse in the morning, sometimes leading to vomiting. This is frequently accompanied by a severe lack of interest in food. The underlying mechanism: uremia. This is a direct consequence of the body being poisoned by its own waste. When kidneys fail to filter, toxins, uremic toxins, build up in the bloodstream, leading to uremia. These toxins irritate the lining of the stomach and bowels, triggering nausea and vomiting. 6. Relentless and deep itching, pruritus. The symptom: an intense, maddening itch that seems to originate from deep beneath the skin and is often unresponsive to normal anti-itch creams or moisturizers. The underlying mechanism: mineral imbalance. This persistent itching, known as uremic pruritus, affects a vast majority of patients in advanced CKD. It's primarily caused by the buildup of waste products and a serious imbalance of minerals, especially phosphorus. Failing kidneys cannot excrete excess phosphorus, which then combines with calcium, leading to mineral deposits under the skin and irritation of the nerve endings. The extreme dryness and hormonal changes also contribute to this relentless discomfort. 7. Metallic taste and cognitive decline, brain fog. The symptom: a strange, unpleasant metallic or ammonia-like taste in the mouth that makes food taste like pennies or cardboard. This is often accompanied by difficulty concentrating, memory loss, and mental confusion. The underlying mechanism: toxin impact on the nervous system. Metallic taste, uremia, and ammonia. The foul taste, sometimes called uremic fader, occurs because high levels of urea in the saliva break down into ammonia, the same compound found in cleaning products. Cognitive decline, uremic encephalopathy. The buildup of uremic toxins affects the central nervous system, leading to uremic encephalopathy. This condition causes brain fog, poor concentration, difficulty finding words, and general cognitive impairment, which can manifest even in the early stages of the disease. 8. Puffiness around the eyes, periorbital edema. The symptom: waking up with significant puffiness, specifically around the delicate skin of the eyes, which may worsen throughout the day. The underlying mechanism: protein loss. This is a critical clue. When the kidney filters are severely damaged, as in nephrotic syndrome, they leak massive amounts of albumin, a large, essential protein, into the urine. Albumin is crucial for maintaining oncotic pressure, the force that keeps fluid within the blood vessels. When albumin is lost, fluid leaks out of the vessels and into the surrounding tissues, with the thin skin around the eyes being particularly susceptible. 9. Difficult to control high blood pressure, hypertension. The symptom, blood pressure readings consistently remain high, hypertension, despite treatment with multiple antihypertensive medications. The underlying mechanism, RAS overactivation, the kidneys and blood pressure are locked in a vicious cycle. When kidney function declines, the organs mistakenly believe the body needs more fluid and pressure. They excessively activate the renin-angiotensin-aldosterone system, RAS, constricting blood vessels and increasing salt/water retention. This elevates blood pressure dramatically, which, in turn, causes more damage to the already failing kidneys. 10. Dry and flaky skin. The symptom, skin becomes extremely dry, tight, and flaky, often accompanied by the persistent itching mentioned earlier, despite adequate topical moisturization. The underlying mechanism, mineral and hormonal imbalance. Chronic kidney failure disrupts the balance of fluids, electrolytes, and hormones. This includes the failure to properly activate vitamin D, leading to calcium/phosphate abnormalities. These imbalances directly impair skin health, resulting in severe dryness and poor skin barrier function. 11. Unintentional loss of appetite and weight loss. The symptom, a sudden, noticeable decline in interest in food, often leading to significant, unintentional weight loss over a short period. The underlying mechanism, catabolism and uremia. The persistent nausea, uremia, and the metallic taste make eating an unpleasant chore. Furthermore, the buildup of toxins puts the body into a catabolic state, breaking down muscle and fat tissue, rather than an anabolic state, building tissue, accelerating both appetite suppression and weight loss. 12. Shortness of breath when bending forward, bendopnea. The symptom, this is a highly specific, later-stage warning. You suddenly feel breathless when bending over to tie your shoes, pick something up, or lean forward. The underlying mechanism, advanced fluid overload. While first described in heart failure, bendopnea is strongly associated with fluid overload, which is rampant in advanced CKD. Bending forward temporarily increases pressure in the chest and abdomen, rapidly shifting existing excess fluid to the lungs and heart, causing immediate breathlessness. This symptom suggests significant fluid management failure. 13. Cold hands and feet, cold extremities. The symptom, your hands and feet feel persistently cold, even when the rest of your body is warm. You may also notice a bluish or purplish tinge to your nails or lips, cyanosis. The underlying mechanism, poor circulation and anemia. This symptom is a consequence of the body's efforts to cope with the core problems of kidney failure. Anemia, low red blood cell count, reduces total body heat. Vascular response. Due to poor oxygen supply, the body instinctively redirects blood flow to the core vital organs, brain, heart, sacrificing peripheral circulation in the hands and feet. This leads to chronic cold extremities and poor tissue oxygenation. Section 3. Recognizing the danger, when to seek medical attention. The terrifying nature of kidney disease lies in its ability to progress silently through stages 1, 2, and 3 without severe symptoms. By the time symptoms like persistent vomiting or severe itching occur, the patient is often already in stage 4 or 5, requiring dialysis soon. Your action plan for early detection. If you experience any of the persistent symptoms listed above, especially if you have risk factors, you must talk to your doctor immediately about kidney function testing. Key risk factors for kidney disease. Diabetes. The number one cause. Uncontrolled high blood sugar damages the kidney filters over time. High blood pressure. Hypertension. Uncontrolled high blood pressure is the second leading cause of kidney failure. Family history. If a close relative has kidney disease, your risk is significantly higher. Age. Risk increases after age 60. Obesity. Linked to high blood pressure and diabetes. The 13 signs discussed here are often subtle, easily dismissed in the bustle of daily life. However, they are the vital whispers of an organ in deep distress. From the profound exhaustion caused by anemia to the strange metallic taste due to uremic toxins, your body is providing a roadmap to early diagnosis. Remember, Kidney disease is not a condition you can treat with over-the-counter medication and hoping for the best. Early detection is not just beneficial, it is life-saving. Knowing the signs and advocating for the correct tests, GFR and ACR, can lead to timely intervention, dietary changes, and medication that can significantly slow progression, potentially helping you avoid the need for dialysis and ensuring a longer, healthier life. Don't ignore the silent alarm. Take control of your health today.